How's it going, everybody? Welcome to this video about learning how to stretch your back appropriately and safely, not only just the muscles in the back, but also the muscles in the hips so that you're able to have a more looser, free back as you're moving. Now, when doing any of these stretches, you want to make sure that there is no pain with any of the stretches. This is more for educational purposes and is not a prescription for any kind of specific back pathology. These back exercises are more just as an example for things that you can do. You want to use the exercises that are most appropriate for what you need and where you feel your stiffness. So let's get into it. My name is Dr. Robert Berghorn, physical therapist and owner of Ascend Physical Therapy on Long Island, New York. I do provide mobile services throughout Long Island, both in Nassau and Suffolk County and some portions of Queens County. But let's get into it. Let's get stretching. The first stretch that we're going to do is simple and easy. We're going to start to do exercises that are more in the bed. So these are simple things you can do in the morning. These are simple things you can do when you're laying around, just relaxing a little bit. So what you can do is you can lay flat on your back, and from here it's just a simple double knee to chest. So all that is taking your hands, bringing them behind your thighs, bringing your knee up to bring your knees as high as you can tolerate without any pain, holding that for about 10 seconds, and then letting it slowly come on back down. You can bring it all the way back down if you want to be a little bit more advanced, or you can just keep it as comfortable as you can with your arms, as long as you don't have any pain, and bring it back up, and you'll be able to get a nice stretch there. This will help with any kind of tightness or restriction you have throughout your low back. This is just a nice, simple, get started kind of exercise that you can do. The next one is also a little bit of a get started exercise, but is also something that you can do to do a little bit of rotation with as well. This is called lateral trunk rotation. So all it is keeping the legs right where they are, dipping from side to side, going as far as you can tolerate without any pain. So going all the way over, holding that for about 10 seconds, coming back over to the other side as far as you can. And then that would count as one repetition because you're going to both sides, and then you would repeat again, holding for 10 seconds on each side. You want to do both of those exercises for about 10 repetitions and doing that for, like I said, 10-second holds. The next thing that we can do is a little bit more of an upward exercise or upper torso exercise. And what you can do from there, we're going to lay on our side. This is called open books, and this will work on increasing the flexibility in your upper torso. As triathletes, as runners, as cyclists, as endurance athletes, we do tend to be more straight plane, so our upper torso can be a little bit restricted, which can lead to low back pain. It's not necessarily something that is diagnosed or something that does occur or does get brought up, but it is something that does, because if something's not moving up here, then you're going to have overflow and you're going to have increased stress throughout the lumbar spine in order to cause rotation, which will eventually lead to back pain. So let's go into it. So the open book, you're on your side, hands out together, you have a pillow underneath your head so you stay nice and neutral. What you do from here, legs stay right where they are, hips stay right where they are. We will open up as far as you can go, getting that nice stretch throughout your low back and throughout your thoracic spine, holding that for about 10 seconds, coming back over, and then repeating for 10 seconds again, and coming on back. And of course you would flip on the other side and do the repeat of that on the other side. You're going to do about 10 repetitions for each one, and you're going to do 10-second holds for each. The next one that you can do that's nice and simple and can be done in your bed is a piriformis stretch. Now there's multiple layers, there's different ways to do a piriformis stretch. Each one can be a little bit more intense depending on what you have going on, and the piriformis is the muscle that's deep within your butt. These next exercises can give you a little bit more of a butt stretch depending on what you have going on or what other muscles are involved, including your gluteus medius on the side here, but can also include your gluteus maximus and the big muscle in the back. But this is more focused on the piriformis. So the first step of doing this exercise, and the most simple way to get it going, is to cross one leg over the other leg. Take your hands and put them on top of your knee, and you're going to take your knee and you're going to bring that knee to your opposite shoulder. So if I have my right knee up on my leg right now, taking my right knee, bringing it all the way over to my left shoulder as far as I can go, until I feel a nice stretch throughout my butt here. You're going to hold that. Now, you can get away with this depending on what part of the day that you're doing. If you're just using it to get going for your day, you can do 10 times for 10 seconds, just like we've done with the previous exercises I mentioned. But you can also do it for 30 seconds for 3 times if you're doing it more at the end of your day, just to help get yourself loose and comfortable before you're going to sleep. So you'll hold that and come out of it, and then you'll again repeat. And of course, you'll repeat on the other side, holding for 10 seconds, going from the taking the left knee and bringing it over to the right shoulder, releasing, and doing that 10 times. The next upgrade to this exercise, and I'll go back to the right side, is crossing that leg over again like I did, and then taking your hands, instead of being on this right knee, you're going to take it, your right hand is going to go between your legs, so it's going to go underneath. Your other hand is going to go on the outside of your left leg. You're going to take your left leg, you're going to bring it up towards you, and you're going to pull that left leg with both arms up as high as you can towards your chest, feeling a more intense stretch throughout the hip and also the posterior, basically the hip region, and you'll feel it more in that, a little bit more of a stretch inside the piriformis region down over here. So you'll hold that for about 10 seconds. We'll do that 10 times. We'll switch over to the other side. This time the left hand will go between the legs. The right hand will go on the outside of the thigh. Bring that up as far as you can towards your chest. And you'll hold that for 10 seconds. We'll do that 10 times. If you're out, now this is the first exercise we're going to do outside of your bed or outside of being in your home. If you're feeling tight, you don't necessarily want to get down on the floor, and you have just maybe a bench, or if you have counter space, or you're sitting in a chair, you can do it this way. So if we're sitting, this can be done sitting at the edge of your bed too. Again, crossing over, bringing that knee across to the opposite shoulder, holding that there. This is similar to that first one we did for the piriformis stretch. And another way of doing it that is similar to the other one, you're not bringing your leg to your chest anymore, but you are leaning forward. The only thing I recommend is this: if you do it this way and you're on your bed and your feet are not touching the floor like mine are right now, because this table is a little bit high, make sure your foot is supported on the ground. Otherwise, you do have the potential to flop off the table, which we don't want to do. So please make sure that you're staying safe at all times. Your one foot is secured on the ground at all times. Leaning forward, bringing that chest to that knee. You'll still feel that stretch in your butt. Holding that for 10 seconds. We can do that 10 times. Switching sides, of course, and either pulling across to the opposite shoulder or leaning forward, getting that stretch in the back of the hip. One last one, in case you don't have anywhere to sit, but you do have some place where you can stand, you can use a table, something similar in height, and what you can do is bring that leg on top of the table or on top of that higher surface if you have the motion, if you have the ability to do it, and you can come on down and get a nice stretch this way, bringing that chest down towards the table, keeping the sole of your foot out straight this way and the side of your foot straight up towards the ceiling, and try and stretch that out. Again, you can do that 10 times 10 seconds, or depending on if you're doing it at the end of your day and just want to get a nice long stretch, can do it for 3 times for 30 seconds with that, just to keep things simple. The next one that we can do is hamstring stretches. Now, there are different ways to stretch the hamstring. The more classic way of doing it is, of course, sitting up on top of on the ground or something similar, bringing that one knee in and then leaning forward. The one caveat that you want to keep in mind is a lot of people, if they start feeling this stretch in their calf, it's not necessarily getting the hamstring itself. You're more stretching your sciatic nerve, so that it is something to be careful of. Also, you notice that if I don't sit right, like I do slump over, and that's due to tightness in my hamstrings myself. So if I'm just doing that, you know, it's all coming from my back. I'm not stretching my hamstrings, so just be in mind with that. You always want to make sure that you have an upright torso as much as possible. You want to have a slight bend in your knee, just so you can take out that sciatic nerve. You're not going to stretch the nerve out, or you're not going to irritate the nerve as it runs down your leg. And then you can lean forward. So if you don't have anything else around you other than the floor, and this is the best way for you to do it, just sit up nice and tall, knee nice and straight, or a knee bent a little bit, lean forward just so you do get more of that hamstring stretch. However, if you're unable to sit upright, if you're unable to hold that core nice and tight in order to do that appropriately, you can do these next ones. So what we can do next is you can either lay on your back, you can bring one knee to your chest, you can hug that to your chest, don't let this thigh move, and holding that thigh to your chest, what you're going to do is just kick, bring your toe up, kick your leg up towards the ceiling as high as you can go. You can see I'm a little tight, and from here you can hold that until you get to about that 10-second mark. Relax a little bit, try and go a little bit further. Relax again, and try and go a little bit further each time. This, because the knee is bent, you are avoiding that stretching of the sciatic nerve. You are getting more of that hamstring stretch, and you're going about it that way. If you have a table, or if you have an elevated surface like your bed that you can do this on, this is the next appropriate one that you can do for your hamstring. Again, because both legs are not being stretched, you know, I'm stretching one at a time, I'm able to maintain a little bit more of an upright posture. Core is nice and tight. Knee is slightly bent so I don't stretch that sciatic nerve. Lean forward at the hip. So motion is not coming from my back. Motion is coming from the hip. Leaning forward, feeling that stretch just in the hamstring, nothing in the calf, nothing in the low back, and you're doing this correctly. One other compensation people like to do with this stretch is instead of leaning forward, what they also do instead of leaning forward, they also turn out their hip. When they turn out their hip like this, or they allow their foot to flop out this way, I can go a lot further. I'm not doing much here. I don't feel it in my hamstring. If anything, I feel it, you know, working my hip a little bit, but nothing that's going on in the hamstring. So keep the toe pointed toward the ceiling at all times. Hips are square, facing towards where your foot is, and then you're leaning forward at the waist with the knee slightly bent, feeling that stretch right in the hamstring. And of course, you switch to the other side. Again, foot towards the ceiling, knee bent, torso nice and straight, leaning forward, stretch only in the hamstring. The next stretch that you can do in order to help anything with the back, just because there are muscles that attach to the hip that do involve the back, is a psoas stretch. So we've always heard of the hip flexors being tight in people. They can also be tight and weak, but that's a different video for a different day. But in order to stretch that out, there's a number of ways to do that too. It just depends on what kind of core stability that you have. So the most simple way to do it, and can be for some people one of the hardest, just because they need the control in order to do it. You want to go off the edge of your bed, especially if you have a higher bed, and what you can do, sliding all the way over, and basically your leg or hip should be positioned so that it's just off the edge of the bed, but your back is still completely flat on the bed. You want to cinch the stomach down, so keep that stomach nice and flat. Back is flat against the table or against your bed. This knee is bent up, your right leg comes off the bed, and you allow your hip to sink down, only feeling a stretch right in the front of the hip right here. You're not letting your back come off the table. Back stays nice and flat the entire time, leg stays completely relaxed, and you go through it. Now, if you want to make this stretch a little bit more intense, if this is simple for you, you can get a strap, a belt, something similar to that, and you can pull on the back of or you can pull on your foot, and you can get your rectus femoris, or part of your quad muscle that also acts as a hip flexor, and you can work on getting that full stretch so you not only feel it here in the front of the hip, but you also feel it throughout the thigh as well. One other way to stretch it, it does require a little bit more control, a little bit more stability, is you can do this on the ground. I'm just doing it on the table for ease and convenience of the video. You want to get into a lunge, and from this lunge position, you want to hold that core tight. You want to squeeze the glute of the leg that's down on the ground, And then from here, you don't want to just lean forward, because if you lean forward, you see my torso is positioned forward. My knee is going past my toe right now. The angle between my hip and my torso is still the same. It's still straight up and down. I'm not getting anything out of this. One other compensation that does happen with this exercise is as people transition forward, they start to arch their back. So when they start to arch their back, they look like they can go a lot further, but I'm not getting anything in the front here, maybe a little bit. The perfect way to do it is to make sure butt squeeze, abdominal squeeze, nice and tight. Shift the hip a little bit forward. I feel a stretch right in the front right here. That's all I feel. You notice that I didn't move as much as I did with the other two. You don't have to move as much. If you go too far with this exercise, you've already blown past it. Again, just like the other ones, you can hold this 10 times 10 seconds. Back off, relax a little bit, squeeze again, shift forward, good to go, stretch right in front. And of course you switch sides for both. One last one that you can do is from here, bringing your one leg up onto a table or a surface. Same kind of thing, you just don't have to squeeze your glute as much. And what you can do from here is you can come a little bit forward, you're squeezing your abdominals, and then you're just shifting that hip forward, or you're just weight shifting forward on your foot. I already feel a stretch right in front of the hip here, and I'm also getting that rectus femoris in the front of the thigh, and I'll show it on the other side just so you can see a little bit more. So coming up here with the foot, stomach stays nice and tight. Not necessarily have to do it with my glute like with this one. And all I do is shift a little bit forward, and when I shift a little bit forward, stretch right in front of the hip, and I get a little bit down into my thigh as well, just like I had when I was laying on my back off the edge of the table. When we're done with the exercises laying on the bed, what we can do is transition to going on to our hands and knees. And we can do a couple exercises in this position. One of those involves the simple cat and camel exercise. Some of you may have heard of it, others may not have. So all this is a little bit of a spinal mobility exercise. So in this position, what you'll do is you will try and segmentally from the bottom of your spine, curl yourself up to the top of your spine, going up as high as you can go. Hold that position. Slowly come on back down. You can do this from the top of your spine down to the bottom of your spine, or vice versa, whichever one you feel more comfortable with. And you should be able to reverse that curve all the way down, trying to arch as much as you can, of course without pain, and then repeating, so coming down from the bottom, segmentally coming up to the top. And you may not have as much control as you may say that I have, but what you can do is just simple, just come down into extension, come up into flexion. As long as you're getting a little bit of a stretch, you're not getting any pain, and you're able to go through that positioning okay. The next exercise is child's pose. Some of you who do yoga may know this one pretty well. So your hands will come out, you'll sit back onto your heels as far as you can go until you get a stretch. Now this stretch will not only get you into the lower back to give you a little bit of a stretch in the lower back, but you'll also get a stretch all throughout your lats and your lateral fascial chain. So you'll come down, you'll stretch, and you'll hold this for about 10 seconds. You can come out of it. And you can do that 10 times. With this one, you just want to make sure that coming through here, you want to make sure that the back stays flat until we get down to about here. And we start to get a little bit of a stretch all throughout the thoracolumbar fascia as we come down throughout the pelvis. In order to make this a little bit more intense, for some of you who don't feel a stretch in this position, you can walk your hands over to one side, and by walking your hands down to one side, you'll feel more of a stretch on the opposite side that you walk your hands down towards. So you'll hold that position here. You notice that my lats are a little bit tight, so what you'll see is my hip won't go down as far as when I was in the center, where I can go down a lot further, and that's okay. So when I just get to that point where I feel like I can't go any further, I just hold that position, and I can come out of it. And each time I go down, I can try and go down a little bit further, and then a little bit further. You want to hold this one again for about 10 seconds 10 times in order to make sure that you're getting a little bit of that effect that's going to last you a little bit. So again, I'm going down to the other side and repeating, trying to get down as far as I can. I hope this was helpful for you guys. These are the exercises that I like to use for my clients in order to help them loosen up their back and their hips, so to take any of the edge off of their back pain. This isn't something that will completely alleviate your back pain, so if it is something that does help but does not completely help you out, please feel free to reach out to me at any time, www.ascentptny.com, or please give me a call at 516-387-4669. I would be more than happy to sit and discuss with you about what has been going on more in depth and be able to help you figure out what the specific cause is so that you can make the best decision about your health, whether you decide to work with me specifically or not. I'm here to help you and make sure that you succeed in whatever you attempt to do. So please feel free, reach out to me if you need it. I'm always here, and I hope this video helped you.